Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine in patients of all ages. Today, I'd like to talk to you about adhesive capsulitis, or frozen shoulder. This condition is often under-recognized. I see many patients for second and third opinions who are told that they have a rotator cuff tear, a labral tear, impingement, biceps tendonitis, but in fact, they have a frozen shoulder or adhesive capsulitis. Why is this condition so often missed? Well, particularly because the physical exam is so important, and oftentimes surgeons or medical doctors in general will use specialized tests to try to elucidate what is going on in a patient's shoulder. If conservative treatments fail, the next step is to order an MRI. However, most MRIs in patients over the age of 35 or 40 are going to show some level of abnormality in the labrum or the rotator cuff, and this can often lead to a misdiagnosis. My goal today is to educate patients on adhesive capsulitis. The number one symptom of adhesive capsulitis is initially pain. That pain then ultimately leads to decreased range of motion or stiffness. So this, for females, may lead to an inability to reach behind their back to put on their bra. For males, it may lead to reaching behind to put on their jacket. For all patients, in fact, stiffness or ability to reach terminal ranges of motion is very apparent in the more advanced phases of a frozen shoulder. There's typically not much weakness, but pain is pretty prominent throughout the day and the night. So if you have a frozen shoulder and are dealing with some of these symptoms, the right treatment is available to you. Physical therapy is by far the most important aspect of treatment for frozen shoulder. Rarely do these conditions need surgery. Physical therapy works on stretching the capsule or the inflamed capsule, which is known as capsulitis. By stretching the capsule, the patient's range of motion returns. However, it's very difficult to stretch and get range of motion when someone's in a lot of pain. So thus, inflammation and pain control must come first. Historically, we've tried injections and medications, but in patients with comorbidities such as diabetes, corticosteroid injections can be very difficult and can cause a lot of side effects. Furthermore, cortisone has been known to weaken tissue. We have thus evolved our technique and management of these conditions to more conservative and non-invasive approaches. This has allowed us to treat frozen shoulder more effectively and safely. We've had successful outcomes treating patients with low-level light, also known as laser therapy. So laser therapy conducted with an appropriate infrared laser can allow for inflammation and pain control of the inflamed capsule. The laser penetrates the skin 3 to 5 centimeters below the level of the skin into the soft tissue, including the capsule. And then the entire capsule around the shoulder is treated under low-level light. This treatment roughly takes 20 minutes, and usually a patient undergoes about 12 treatment sessions with an advanced laser. After about 4 to 5 sessions of laser therapy, then physical therapy is introduced. Now physical therapists are successful at mobilizing or stretching that capsule because the patient is overall more comfortable and the capsule is less inflamed. A typical treatment course lasts 4 to 6 weeks, and we found tremendous success in getting patients back to feeling great without pain. If you have a frozen shoulder or adhesive capsulitis and would like to get better, please don't hesitate to reach out to us. I look forward to meeting with you.